Hi, my name is Mary Alt, and I'm an associate professor in the Department of Speech, Language, and Hearing Sciences at the University of Arizona. I'm also a clinically trained, certified speech-language pathologist, and I'm so happy that Talking Matters invited me to talk with you about my area of expertise, something I have a passionate interest in, child language development. Because we know that people have many questions about child language development, this video provides an overview of frequently asked questions and some answers. Sometimes you'll see frequently asked questions written as FAQs. In this video, I'm going to give you an overview of the frequently asked questions section of the Talking Matters webpage, which has been divided into 4 main areas that people have questions about: milestones of development, speech and language delays and what to do about them, strategies that help children develop language and successful communication, and bilingualism, or what happens when children are learning 2 languages. I'll highlight some of the specific questions people have in each of these areas and give you a broad overview of some of the answers to these questions. Basically, I'll cover the principles. However, I hope you will go to the resources on the sidebar of this webpage and look at the specifics in the FAQ, Frequently Asked Questions section. That's where you'll find not only general answers to your questions, but also some very specific answers. And if you have more questions, there's the Talking Matter talk line at the University of Arizona that you can call and talk to a speech-language pathologist who can give you more information. That number is also on the web page. So let's talk about language development. There are so many questions that parents have about language development, and that's fantastic, because if you're asking questions, that means you want to do the right things for your children. We're here to provide you with resources to answer some of those questions, both through this talk and with the other resources on this web page. First of all, it's really important to realize that whenever we're talking about human growth and development, there's going to be a wide range of what's considered typical or normal, and strategies that may work for one family may not work for another family. So it's important to remember that individual variability must always be considered within the answers we provide. The questions we're going to talk about are real ones that parents in the Tucson community have asked us about their children's language development. We found that the questions could be grouped in the 4 categories I mentioned. Let's begin with the first category. What should I expect for my child's language development? A parent's desire to know what happens next in just about every aspect of development is present throughout a child's life. A lot of people really don't know what to expect in terms of language development. For example, a lot of people don't realize that there are a lot of language or communication behaviors that happen even before a baby is 1 year old. So, some of the questions parents have about language are: what's normal? What's typical? What should I be looking for? Are there differences between boys and girls? How big are those differences? What should I expect? And even, am I doing something wrong? Let me give you some broad answers to these questions, and you can look in the FAQ section under milestones for more details. As I mentioned before, there's a lot of individual variability. So what one baby does at 1 year, another baby may do at 10 months, and another typically developing baby may do at 14 months, and all 3 babies are on target. There are expected milestones for development for children, and we can start looking for those milestones right from the get-go. One thing that's important for you to know is that there are developmental milestones or things we expect for babies within the first year. For example, we expect babies to make eye contact with their parents. We expect babies to follow a parent's gaze when they're looking at something. We expect babies to start babbling or making different sounds that aren't words. We expect babies to play. We expect babies to respond to their names. We expect babies to use words when they're about 1 year old. We expect them to begin using words together like "mommy up" or "more juice" by the time they're 2 or even earlier. We expect them to use simple sentences like, Nana's coming by the time they're 3. I could go on, but the point is we know a lot of things about language development and when we expect to see certain behaviors. It can be fun and exciting to take a look and see what those patterns are. When you learn what goes into communication, you'll really appreciate all the little things your children are doing. The main thing you want to look for in your child is good communication. You can help your child by knowing what signs to look for and by actively engaging with them. You can look at our milestones section to learn more. Are there differences between boys and girls? There are, but they are typically minor. So even though we expect girls to develop language a bit sooner than boys, we expect all children, for example, to say their first words at age 1. There's not a separate set of norms for boys, so boys might be a little later, but they still should be within that window of what we expect for all children. And individual boys are going to be different than individual girls. I can tell you that in my family, my son was an earlier talker than his sister was at the same age. That goes against what the statistics would say, but that's where, as a parent, you have to remember that you are raising your unique child, not a statistic. Now, I really want to turn to this last question. Am I doing something wrong? No. If you are here learning about language development, you aren't doing anything wrong. Children are incredibly resilient, and as long as you are making an effort to communicate with your child, you aren't doing anything wrong. Even when a child has a language problem, it's important to know that adults cannot cause children to have language delays or impairment, except in cases of serious maltreatment. That said, there are a lot of things you can be doing to facilitate your child's language growth, and we'll talk about that in just a little while. But the fact that you are showing interest in your child's development is a fantastic place to start. There are a couple of reasons people want to know what is typical and what is not. One is natural curiosity. Another one is to make sure their child is on track. One thing we know is that the earlier we find out if a child has a delay or a disorder, and the earlier we provide them with therapy, the better their outcomes are. So that brings us to our second topic. How will I know if there is a delay, and what will I do if there is one? So first, if you are worried about your child's language development, it's better to do something about it instead of just worrying. Find out. Talk to your child's pediatrician and ask for a referral to a speech-language pathologist. Get your child evaluated. If your pediatrician says, "Don't worry, they'll grow out of it," push hard and ask for a referral anyway. Speech-language pathologists have years of training specifically on language. Pediatricians don't. While your child may grow out of it, know that early intervention only works if it happens early. And if you just wait and see based on a hunch, you're going to miss that window of opportunity. On the other hand, if you get an evaluation, you may be soothed by knowing that your child is on target. Or you might take part in watchful waiting, where you know specifically what to look for next and probably will get a few techniques to help your child. Or if your child is diagnosed with a problem, you are in a perfect position to start doing something about it to help your child become the best communicator he or she can be. When should you be worried? You should be worried if you feel your child's communication skills aren't what they should be. If you feel like your child is getting really frustrated, or you are getting really frustrated and you can't understand your child. Quite often, a parent's feelings or worries about their child's language are well-founded. You might also be worried if you have family members or close friends telling you they have a really difficult time understanding your child. And if you're familiar with language milestones, you can be checking to see if your child is meeting those. For example, if your baby is less than 1 year old and doesn't babble, doesn't gesture, and doesn't make eye contact, then that's something to talk to a specialist about. If you have a 1-year-old who isn't using words, that deserves attention. If you have a 2-year-old who doesn't have at least 50 words and isn't combining words, that's a red flag. If your 3-year-old can't follow directions and most people can't understand him, that's a red flag. There are other red flags, but these are some of the big ones. You can find out more about red flags on our webpage. In terms of preventing language problems, remember that you can't cause a language problem. Thus, you're unlikely to be able to prevent a language problem. Although we don't know exactly what causes language impairments, we do know they are brain-based disorders, some of which have a genetic component, meaning that they may be passed down through family members. We know you can minimize the risk of having a baby with language impairment or any other developmental problem by having good prenatal care. However, there's no guarantee that even by taking the best possible care before a baby is born, that you can prevent a language problem. That said, a true language problem can be minimized by good therapy and a language-rich environment. So how do you get your child language therapy? First, he or she should have an evaluation. The very first step is to go to the pediatrician to make sure that your child can see and hear and that there are no other medical issues going on. Then, the pediatrician will make a referral to a certified speech-language pathologist. That person will do an evaluation of your child. It doesn't hurt at all. This isn't a physical examination. It's an examination of your child's communication skills, although they may examine your child's mouth. They'll ask your child to talk, play games, they'll interview you and observe you interacting with your child, and based on their training and experience, they'll be able to tell you whether or not your child's behaviors are on target, a little bit behind, or something that really needs intervention. If your child does need intervention, they'll start working with a speech-language pathologist. They may work directly with your child, or they may train you as a family member. It really depends. There are a lot of different models. We do know that speech-language therapy does work and can help your child get to a place where they no longer need the therapy and can function without it. Bottom line, if you are worried, see a speech-language pathologist.